In this episode, we'll explore the breakdown of costs that make up a hospital stay in a public versus a private hospital, and how costs are determined. The Australian government subsidises, in full or in part, payment for items listed on two approved lists. 1. The Medicare Benefit Schedule, or MBS, which covers doctors and specialist fees and using certain technologies. 2. The Pharmaceutical Benefit Scheme, or PBS, for medicines and vaccines. The government decides a fair price for items on these lists, like the cost of an operation, a medical appointment, and medications. When a patient is admitted to a public hospital, if any procedures or medications are used from either the MBS or PBS list, the patient isn't charged for it. In the private system, the government pays 75% of the MBS fee for treatment for patients admitted to hospital, and the patient's insurer covers medical benefits limited to 25%, plus any gaps if the doctor is participating in Bupa's medical gap scheme. PBS items are covered where there's a private hospital agreement with insurers. Lucy is in pain with her knee. She needs a full knee replacement. Lucy should talk to her doctor to understand the costs of her surgery before it goes ahead. She should also speak with her health insurer to confirm exactly what she is covered for so she can make an informed financial decision. Surgery for knee replacements is number 49518 on the MBS list and costs around $1,300 where the doctor chooses not to charge more than this fee. Lucy's insurer will also cover her hospital stay, including theatre costs, nursing care, food and hospital admin fees. The other big cost paid for by Lucy's insurer are any medical devices, implants and other materials used during surgery, known collectively as prostheses. Lucy's knee joint device, selected by her surgeon, is nearly $3,000. The insurer covers the amount dictated in the government's prosthesis list for Lucy's knee. During Lucy's hospital stay, she may also encounter costs such as pathology and radiology that some insurers will also cover, depending on the patient's level of cover and policy chosen. Lucy's hospital stay could easily add up to over $10,000 for this relatively straightforward operation. A complex cardiac operation can cost over $95,000. Health insurers are restricted over what they can pay once Lucy leaves hospital. When Lucy leaves hospital, she's an outpatient, and her costs will be covered by either Medicare or Lucy herself. Health insurers are constantly advocating to government how they can fund new care models in the community.